Hey, what's up guys? Dr. Jim coming at you here on a Thursday from Rubber City Chiropractic South. Today we're at the Portage Lakes location. Hope everybody's having a great day. And I wanted to go over a few things that I've been getting some messages on as far as daily hip care. For some of you guys who've been squatting, getting an anterior hip pain, kind of something that's in this little region here, or maybe because you're sitting all the time now at home. During the pandemic, we've just been at home, kind of a new normal. Of course, everybody keeps saying that term, but you know, a lot of my folks are working at home with their family now being at home, so they're sitting way more than they ever have, and they're not finding enough ways to get out of certain positions that are creating cranky joints. So I'm gonna give you a handful of things that you guys can do for an assessment, and then also as a possible fix to kind of clear the space, so to speak. And maybe this will get you in between your adjustments wherever you're at in the world. Hopefully you guys have a chiropractor or somebody who's a mobility specialist helping you. So let's go ahead and get started. So, and we'll throw some challenges in at the end too. So, you know, as you guys see me sitting in this position, a lot of folks recognize this position as 90-90, but a lot of them can't sit in 90-90, so we change it a little bit into shin box. So what you see here is normally in 90-90, the lead leg would be directly out in front of the hip, knee at 90 degrees, hip at 90 degrees, with the trail leg also in alignment with the hip, 90 degrees to the knee and out. So this is true 90-90. A lot of people can't sit here without dumping the spine, okay? And I don't want to see a dumping of the spine just to get us in a certain position. If you are going to try 90-90, I want you to take this hand and post it a little bit wider so you can keep the integrity of the spine here and not worrying about dumping it down, because I don't want there to be a pinch here. This is going to be something that we're trying to help create a better hip for also the lead leg and the trail leg. So if you're going to do 90-90, post out here. But for those of us who can't really sit in this position, let's make it easier and we'll go into what's called shin box. So instead of the knee being here, slide the knee out a little bit, okay? So now you got the foot more comfortably in this region, the groin region. And then for the back leg, instead of you being at 90-90, go ahead and let it come up and let the foot come towards the butt. So what it does is it kind of looks more like you're creating a box with the shins instead of it being so, I guess, asking or complicated for the hip. So this is way more easier. So what we want to do once we're in this position is simply just breathe. That's step one. Sit here, breathe in through your diaphragm. If you're not able to breathe in a certain position, the old saying goes that you don't own that position. Same thing in the bottom of a squat. If you can't comfortably sit there and breathe, you don't own that position. Your body neurologically doesn't feel safe there. It won't grant as much range of motion. So you gotta own the breath in these positions for your body to feel comfortable here. So normally when I put someone in shin box or 90-90, the first 2 minutes is just sitting there, 4-second inhale, hold at the top for 4, and exhale for 4. At the bottom of that breath, hold for 4. So you're creating what's called box breathing. So 4 inhale, hold it for 4, exhale for 4, and then hold that out for 4. You can also do 4-4-8 breathing, which is a 4-second inhale, a 4-second hold, and then twice as long on the exhale, okay? Whatever your guys' cadence is, it's your favorite, go ahead and stick with that. But this position, I just want you to sit here. See what your body feels. A lot of you guys might feel like that lead hip is so tight because you're just sitting all day long. This back one, I definitely know it's not gonna feel very comfortable, but work at it, okay? Flexibility doesn't happen overnight. This takes me years to get to the point where I can sit here comfortably and not wanna shake or cramp or just get out of the position altogether. So shin box, 90-90, hang out there for a little bit. There are ways to expand range of motion in this. We're gonna cover that in a different video. I just want you guys to be comfortable being uncomfortable in these positions, okay? So again, flip to your other side, hang out there for another 2 minutes, and just see the differences. I'll be honest with you, my left hip, way more restricted in internal rotation than it is on the right side. So I'll sit here for maybe 3 minutes instead of 2 minutes because I want my weaknesses to become more balanced with my stronger side, okay? For some of my athletes out there, you might be like, why do you care about internal rotation? I care about internal rotation because sometimes, all the time, that's gonna limit you in whatever sport-specific movement that you're doing, okay? And you gotta be able to do external rotation. You want that hip capsule to be able to move freely within its own joint. If these joints can't move independently, then how the heck can they move when you ask them to move interdependently, okay? So make sure you guys work on your weaknesses. I'll tell you right now, I'll spend way more time on my internal rotation on my left side just so that I don't have you know what I mean, at the end of the week, I've put more work into it. So by the weekend, when I start doing some of my more challenging mobility work, it's ready to go, okay? So this is part of my daily. In the morning, I'll sit there and I'll kind of work and see what positions feel good. So we'll hang out there for a little bit, okay? So that's gonna be 90-90 and shin box. That's just the primer, okay? After this, let's start to wake up the capsule with some actual movement. Notice this is kind of static. Yeah, you might be moving the torso around, see what feels good, see what feels sticky. But now I want to get you on all fours so we can work on what's called hip cars. Hip cars can be challenging. Let's make them simple for today, okay? So notice that my hands are stacked under my shoulders, and from the side, same thing. Hands stacked under shoulders, and I probably would move a little bit forward so now that my hips are actually in line with my knees, okay? Nothing wrong with you doing it back here, but I just wanna make sure that the core is packed down and we're not seeing any spinal extension or over flexing when we're doing this. We just wanna move the joint that we're asking to train when we're doing cars, okay? So for the hip, what I want you guys to do is you're gonna go ahead, find neutral spine, take this leg, flex the hamstring, and then we're gonna push the foot to the ceiling. Once we get there, that's as far as I got, and if I go any further, I'm gonna cheat with my lower back, and I don't want that. We're gonna bring the knee and the ankle up and out to the side. This is happening extremely slowly, and then we're gonna control that up to the elbow or shoulder, depending upon your flexibility, and then we control it back down, okay? You're gonna run 2 of those one direction, 2 of those the other direction, and you got 2 legs, so you gotta do both sides. I'll show you from a different angle. Again, you're gonna preset the spine, sending the foot up towards the ceiling, knee and ankle come out to the side, and then continue up towards that elbow, and then go ahead and control it, set it to the floor, okay? And then you'd work the other direction as well, okay? So those can be tough, and you can easily cheat. So if you feel like you're cheating, slide your body towards a wall. That way you have a barrier so your body's not gonna start cranking on the spine, and that'll keep you true, okay? So if you're doing your left leg, slide the right side of your body against the wall. That way you have something for feedback, and you'll see if your body's gonna start cheating with other joints, okay? Your body wants the path of least resistance, and when you haven't trained these things, can't blame it for trying to find other ways to get the job done, okay? So that's hip cars, and I'd say that is safe to do every day. Low level, okay? So maybe an effort of 2 or 3. You're not going 10 out of 10 first thing in the morning, okay? You're just trying to let the brain talk to those sticking points. And remember, cars can be done for any joint in the body, including fingers, wrists, elbow, shoulder, full spine, hips, knees, ankles, toes. You name it, man. There's a car for everything. We're just speaking about hips today, okay? So we primed it with shin box. We primed it with 90-90, whatever feels like appropriate for you guys. And then we got into hip cars. Now I want to get into something that we can start working on as a challenge for internal and external rotation. Like I said, super important, especially for my athletes out there. So what we want to do is we want to get in a position where we can post up and create a little bit of twerking in the hip safely for what's called external rotation. So if I get you on the side, we can straighten this back leg out and we come into where the knee's in alignment with the hips. We're going to bring this ankle off the ground just enough for a piece of paper to slide underneath it, or whatever your ability is, okay? For me, I've worked on this quite a bit. I used to only be able to get it just like right to there, and now without cheating, I can get, I don't know, 3 inches, 4 inches off the ground. Pretty proud of that, but it didn't come overnight, okay? It's really hard. This hip wants to cramp, you know, as it's working through some of these things. But what you're gonna do is you're gonna lift up and hold for, let's say, a 5 count, and then we control it right back down. Don't just bring it up and let it drop. I want you guys to control the hip and then come back down, okay? So that's for external rotation. So the hip is turning externally up into the capsule. Then for the trail leg, that's where we can actually train internal rotation. So the hip here is gonna turn in, and the way that we're gonna accomplish that is, again, post up on the side here, and then we're gonna come in, use this hand as almost like a C, set it right on the hip here, and you're gonna just lift the trail leg off. This one's really easy to cheat, so make sure you guys stay true, almost like you're doing a little side plank here. Just make sure the spine isn't cranking. This should all be felt right about this spot here in the hip. Again, a good 5 count is appropriate, and aim for 3 to 5 really good reps, okay? Nothing crazy here. And then of course you got the other side, so you'd have to flip and accomplish the same task on the other side. So let's put it together with a little bit harder challenge, and we're gonna go after what's called hip flexion. Even though you're in these positions all day long sitting, it's still important to train some of these smaller muscles, especially at end range. So when we do this, it's highly likely that you're gonna cramp right at the corner of that hip where the thigh muscle seems like it attaches up there, little tiny muscle called rectus femoris. It will probably light up on you. That's okay. It just means that your brain probably hasn't talked to this muscle very often, if that often at all. And it's cramping because it doesn't know how to contract or relax. So when we put it in a position like this is a highly common position for people to cheat as far as rounding of the back. So what I will do is, as someone gets a little bit more comfortable with it, I'll put them against the wall to keep their back true, okay? So let's get to what I'm explaining here. So I do like for folks to be, I should say, almost at a 90-degree position where the head is nice and tall, the spine is long, and we're not seeing any rounding in the back. If I round in the back, when I go to fire this, it's so easy for me to hold that there. Whereas if I'm up and I'm true and I'm packed, I can't get as far. And I'm really asking a lot from that high hip flexor area, okay? So what I'll do for some folks is I'll set a yoga block up to their lower back. And if they cheat, you see how the motion's happening from their lumbar spine, not actually just happening from the hip, okay? I want quality, 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 okay? I wanna make sure that if we're training something, let's make sure we're actually doing what we're asking it to do, okay? So when we do these challenges for the hip, we can do just straight up lift offs. So again, if I'm working with this leg here, I guess I'll set this one out. We can just lift, hold, set it back down. I like hovers. So what we can do is we can do something like a yoga block and we can set it just lateral to the foot. And again, we'll lift, hover, set down. And then lift, hover, set down. If you want to make it more challenging, you can set something up a little bit wider or a little bit wider. So you've got options. So you can lift, hover, set down, lift, hover, set down. And if you got to lift, hover, set down, you have to wear some different pants here, I'm gonna tear them. So then you obviously need to come back, controlled as well. So don't rush through those things, take your time. But after 1, 2, 3 passes, that's it. I mean, you're gonna fatigue some of these muscles and you might even feel it tomorrow just because you haven't really been training them before, you know what I mean? Which is a good thing. I want you guys to feel like we're actually accomplishing new things as far as movement goes and challenging, because if you're not challenging the body, nothing's gonna change. So that's for hip flexion. And again, you can just do the lift offs or you can do the lift off with a hover, new breath, new hover, new breath, new hover, and then make your way back. Take your time, there's no rushing here. Remember, you're trying to train the body to be comfortable in these uncomfortable positions. Last thing I'll leave you with, because we're pushing 13 minutes, probably by the time I'm done explaining this last thing, we'll be close to 15 minutes. I wanna make sure you guys know that it's also important to be training a little bit of hip extension too. When we do hip extension, it's just really common for people to be cranking the lower back. So when we do anything with hip extension, prone, sometimes people will initiate the movement with their lower back. I don't want that. So if you have to visualize clenching the butt cheeks or tilting the pelvis, like my hands, I don't want it to be anteriorly tucked, I want it to be posteriorly tucked. So if you have to rest your head down, something like a yoga mat, a yoga block, or your forehead down in your hands, whatever you gotta do, I like to lift and then we bring the leg up and out into a frog leg. And that just lights up the side of the glutes. You will probably once again cramp in some muscles that you normally would feel if you had a band around your knees and you were doing like banded walks, like lateral walks or monster walks, those kind of things. So again, once we're here, let the pelvis go the wrong way, then tuck it, and then we're gonna lift, internally rotate, and then send it back to hip extension, and then put it right back down. So you can start with the leg straight, lift, externally rotate, high with the knee, set it down. Or you can bend the knee first, which will be easier, and you can lift, make sure it's coming from the hip only, not the lower back. Let the knee come up and out, control it, and then set it down, okay? So again, I like everything when it comes to these in 3 to 5 reps, and then you can rest. But I don't really, challenge this, but more than maybe twice a week, so you don't have to do this daily. Hip cars daily, yes. But as you get into some of the other challenges, throw those in on Wednesdays and Sundays. If you got a little extra time in your week, split the week with it, do some of the challenges then, and then throw it on a day on the weekend if you have a little bit extra time. And you'll start to see every week things change as far as mobility. You might hit the bottom of a squat differently and you feel like, oh my God, just landed down here. So much space, you know, at the bottom of this. Hip hinging might feel differently too. So if you're pulling anything from the ground, deadlifts, kettlebell swings, in the next couple of days, these gyms are going to open back up. Today's the 21st, so we still got you know, a couple more days here. You know, just remember, as you get back in the gym, I know your coaches are going to coach you however it is that they're primed to coach, or whatever their MO is, but you know, make sure you take the responsibility of quality. If something doesn't feel right, don't force it. Don't let the weight just drive you down into the bottom of the squat. Make sure you can control and own all the degrees that you should have as your mobility prerequisites. If you don't have the actual proper prerequisite for a certain movement of a certain joint, like the hip or shoulder, and something feels like it's pinching or it doesn't feel like you have control over it, don't force it. That's how you're gonna get injured. Take my card, see you next week. You know, it's just one of those things where you gotta make it just as important as training the big sexy movements or whatever it is that's on your whiteboard of the day. You know, make sure you guys are actually prepping the body and seeing and assessing, you know, what exactly you have as mobility that day. I have, you know, tons of injuries that have happened to my one shoulder, and there's days that I wake up and it feels awesome. I can do anything with it. Then there's some days it just needs a little extra priming first thing in the morning, and then I can do anything that I want to do, you know, throughout the rest of the day. But if you don't take the time to do that stuff, it just builds up, and before you know it, you're going to get injured, you know? So just please, 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 anytime I put stuff up that's mobility based, it's not to be, you know, beaten into the dirt, but we got to take time for this stuff, you know? And no one's going to care about it more than you will. I might, but you know, it's one of those things where I don't blame the coaches because they can't make, you know, it long and drawn out for everybody who comes into the gym, because if they're working with 20, 30 people, they all have their boo-boos, and you know, they can't always spend time tailoring the mobility for each person, or the class would never begin. So just, if you have questions, reach out. I'm always happy to help you guys. We're now pushing almost 18 minutes on this video, so I hope this was informational and helpful. It's just I had a collection of messages come through over the last couple weeks, and I figured we'd just spearhead it with some daily movement, some daily challenges, and then you can assess and see how you feel over the next couple weeks, okay? I gotta go. I'm sure there's some patients that are about to be coming through the door here, so I hope everybody has a great rest of your week. Don't be a stranger. Please reach out if you need anything. Other than that, have a great day. Dr. Jim, signing off. See you guys.